When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
HSA's cardiology clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
Welcome back to another episode of Healthcare Today with the HSA. I'm your host, Chuck Taylor. And each and every week we get together with professionals within the health organization and we talk about things that's related to you. And this week we call EMS Week. For a great reason, we want to showcase and talk about all the wonderful things our emergency medical service does throughout the island and worldwide because this is an internationally recognized week. And so I have two great professionals here with me. Go ahead and introduce yourselves, gentlemen.
Michael Blackburn.
Kendal Connor.
And so in the MSS industry, what exactly do you guys do?
In EMS?
EMS.
Yeah.
MS.
Well,
no, that could be Microsoft, but you guys
right,
are still in that industry because you use a lot of high-tech industry stuff now. So give me a little bit about what you do and how it relates to us here in the Cayman Islands.
Well, for EMS, first of all, it stands for Emergency Medical Services. So that essentially tells you what is we doing. Anything emergency medical. As we all know it, the ambulance service is what most persons know it as colloquially. Mm-hmm. So the ambulance service, any kind of emergencies, from airway, anything to do with anything you have an emergency with. So airway, breathing, circulation. So that's difficulty breathing, any kind of, mental status changes and the kind of trauma. So the car accidents, for example,
right.
like you mentioned
I was just
earlier.
about to say, when they talk of EMS services, most people think that it's immediate car-related or vehicle-related stuff, but it's far beyond that.
Yes, it's medical. So whatever the A&E, the accident emergency unit does at the hospital itself, we're doing pre-hospital care out on the road in the ambulances or in the homes, and then allowing for patients to come to get
so
further.
you kind of stabilize them to get them to transport and be able to be seen. So basically, you kind of are first responders. You guys
we are
the
first responders.
First on the scene. You're the first to get the information. How challenging is that?
It can be very challenging, because a recall is different. You may have, 4 car accidents or 4 chest pains, whatever, 4 abdominal pains, but they're all different. So the challenges, like the loved ones is like, well, where's the ambulance? But, we got to encounter with traffic and all that sort of stuff, different environment,
speaking of traffic, let's talk about that. When you see or hear an ambulance, what is the first thing you're supposed to do? If I'm a driver and I'm driving with the kids and I'm heading down the road and I hear or see the ambulance, what should I do?
Well, first thing you should do is when you hear the ambulance or any sirens, matter of fact, for that, pull to the left.
Right.
Pull to the left, especially in the 3 lanes and stuff, the 2 lanes. Some people just say to the right. Please, we're asking, pull to the left. Because if you're just in oncoming, you're pulling to the left. So regardless if you're in a 2 lane or a 1 lane, continue to pull to the left.
Yeah.
Mm-hmm. And that gives you enough access to go through. Without being impeded by any other vehicles. Because one of the you guys, are heroes in mind, because not only are you driving to save somebody, you got to get them back in time also.
Right.
To literally, time is the essence with a lot of things.
Yes.
It's literally life-saving. You guys are excellent drivers, but then you're doing so much inside of your vehicle also.
Yeah.
So tell me a little bit about that, the care that you guys, because I heard that one of your vehicles could be upward of $250,000 somewhere. It's pretty expensive.
Yeah.
So you guys are entrusted with this, but then you got oxygen. You got all these things going on there. Tell me a little bit about that.
Well, our care, normally it's either one or two categories, illnesses or injuries, right? Like I mentioned before, illnesses or injuries. So, for example, let's say we have a chest pain, like a cardiac event. Someone is having a cardiac event. You get called to a patient. You're looking at someone who's probably diaphoretic or sweaty, having pain in the chest. Usually it's like center the chest or something like that. You might be having radiation pain, so going to the jaw or the shoulder, something along these. These are some symptoms that people might be experiencing. Okay. In that case, we'll show up at a home and we'll do our assessment. We'll be given our assessment. Of course, we're, like you mentioned, professionals, so we coming in, introducing ourselves, we asking what's happening, do our assessment, find out where the pain is, exactly how the pain is described, things of that nature, and then we deliver treatment. For a chest pain, it may be something as simple as giving some aspirin, right, or nitroglycerin, which is another medication we may be able to deliver, and then we have oxygen. So on our trucks, we have all of this. We have our access to drugs that we can give, and then we also have things like oxygen. So I'm an EMT. Basic is what it was formerly known as, but I'm an EMT. Mr. Kendal here, he's an intermediate, so he's a level up above me. He is considered ALS provision for delivering care, and I'm considered just basic. Okay. What that means is he has the ability to deliver, and within our truck we have, like I mentioned, drugs that he has the ability to deliver to help to stabilize a cardiac event, for example.
I'm not cutting in there, but
that's
the ALS drugs there.
Drug.
Right. Right. So I have all those on the ambulance, and so there's, and with the ambulance nowadays, the people say, well, it's just the drivers, no more drivers. We're all tending, just as it's a basic, but a very advanced basic as well.
And that's the thing that I don't think people understand, that you guys are medically and professionally trained.
Yes.
Not just I'm just driving to a location, picking people up and returning to the hospital.
Absolutely.
No, you guys are literally doctors on wheels to that level, because you guys take care, stabilize, and get them to the care that they need inside a medical facility.
Yes, yeah. So we have, there's a clinical aspect to what we do. For me, I may not be able to deliver some drugs, but, for example, handling a BVM or a bag valve mask device, for example, breathing for someone, knowing how to deliver that appropriately, even delivering oxygen, something as simple as oxygen, knowing when to give it, knowing how to titrate it, which is making sure that it doesn't go above a certain percentage when delivering it, depending on the patient I have, knowing how to avoid, delivering things that are shouldn't be given to someone. For example, if someone's having a cardiac event, it might not seem like much, right? But I know, because I'm clinically trained, I wouldn't want them to exert themselves beyond a certain, movement or anything like that, because I don't want to exasperate their what they're experiencing or anything like that.
And I just wanted to also cut in here and let people know that you guys deal with a lot of dive patients and stuff like that. So you're already talking about somebody who already has oxygen or nitro oxygen. You're dealing with that, so you have to know where is the right amount to keep that person stable, keep them alert, to give them the best possible chance of survival till you can get them to a facility.
Yes.
And I mean, our island is so diverse, and and it has so much different. It's a 24-hour society now.
Yeah.
In the old days, people used to say, oh, we go to bed at 11, 12 o'clock. But those days are over and done with. So you guys are on call 24 hours in different capacities and different shifts. Talk to me a little bit about that.
Well, we do 2 12-hour shifts. It's go on 7 a.m. till 7 p.m. and 7 p.m. till 7 a.m.
Okay.
Every day of the week, 24 hours a day. And we have 3 ambulance stations, one in North Side at HSA and one in West Bay at the health center. We have 3 trucks operation at one on each shift, and we have spare trucks. We just have got state-of-the-art new vehicles just arrived on the island.
Right. I kind of got, social media. I saw that and I was like, oh, you guys got the prettiest vehicles, but they're work vehicles, but man, it looks good.
Yeah.
Thank you. We well deserve them, and we do take care of vehicles. That's why we always striving to get new ones, but when we do get them, we take excellent care of them.
Right.
Also, all the trucks, we have new equipment, new stretchers, state of the art, saving on our backs, because that's one of the major problems in EMS is back problems.
Lifting, moving,
all of this.
Right. But with these new stretchers now, you can practically go over, like a wall, say 2 feet high or whatever, because the legs can come up. You have to be there to see that.
I was going to ask you about that. Cayman, it's not like the States or someplace where it's all concrete. You're easy rolling up, easy roll. We got gravel. We got yards with sand. We got fencing to go over. There's a lot of movement that you guys have to do sometime to get to a patient, to get them back to your vehicle. And you're saying that it gets a lot easier now with these types of stretches.
It is a lot easier, and our EMS manager has spent a lot of time, getting these vehicles, new stretchers, monitors, everything on board for us to make life easier for each and every one of us.
Excellent. Folks, we're going to take a quick break and come right back. If you're tuned in, this is Healthcare Today with the HSA. We're talking to these wonderful heroes from EMS. This is EMS Week. We'll be right back.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
HSA's cardiology clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.
Now back to Healthcare Today with HSA and our host, Chuck Taylor.
Welcome back to Healthcare Today with the HSA. I'm your host, Chuck Taylor. Each and every Friday and Saturday, we get together and do this at 1 p.m. This is all about the wonderful service and management that we have here in the Cayman Islands when it comes to healthcare. And we're talking about EMS Week, which is, and gentlemen, go ahead and introduce yourselves again, and then tell us what exactly is EMS Week, and we'll continue the conversation.
Okay. Hi, everybody. Good afternoon again. My name is Michael Blackburn. I'm an EMT with the HSA.
Good afternoon as well. My name is Kendal Connor, EMTI, and been there in the position now. October coming this year be 30 years.
Long time.
Wow. Before we move on, I'm glad you said that. If I'm listening and I'm a young Caymanian and I say, okay, you know what? This may be something I would think to get into as a career, because I don't want our young people to have a job anymore. Forget about jobs. A job is short-lived, my listeners. We want you to have a career. If I wanted to have a career in the industry that you're talking about, what would be my steps to get involved and move upward, mobile in that industry?
Well, right now we're doing a lot of on-island training. We have our own trainer locally. And, they just completed a class, EMT Basics, and they're about to be, distributed on different trucks throughout the island. The career that I've had, love to see a lot more Caymanians come forward, because the programs is there for the young Caymanians as a whole. So I'm pleading with you all, get an application form, fill out at HSA, and come and join the ambulance department. It just feels so good to know that when you get off shift 7 a.m. or 7 p.m. that you have done so much to help, your community, help the people. It's such a good feeling.
You've saved a life.
Yeah. Yes.
Realistically.
Yeah, and talking further about the training and stuff like that. So I can't consider myself young anymore, I don't think, but
you got hair. You're young.
Well, I keep that one. I'll take that one. But I was trained here on island, with one of the cohorts back in 2015, and got trained there. Came over here. So, and what we like Ms. Kendall mentioned, what we're doing is furthering that training, allowing for more persons to come in. And if you, for example, we just completed a cohort like he mentioned, and at the moment, I myself and then at least 2 or 3 others are looking forward to advancing, because we're delivering also an advancement program. So we'll be bumped up to a level similar to Mr. Kendall's level at the moment, though he has much more, experience and training aside from what we'll get coming in. That program is kicking off sometime this year soon, God willing. So we're looking forward to that. For persons who, say, if you're listening and you find yourself interested in a career in EMS, it is very much possible, and we're making it very much so, even more so possible. Just the other day, I worked Saturday and Sunday. We had a young lady who came on, and she did what's called a ride along. So if you're interested or you're not sure if you're interested, what you could do, contact the manager, Mr. Stephen Duval, or just HR at the hospital, and say, hey, I'd like to come out and get an experience. I'll bring you in, give you a little taste. It's safe. We make sure that, you're just really an observer, just learning, and see if you would be interested in doing that. A ride along, you'd get, sign a form saying a consent form, and, necessarily.
What's the youngest age that they can do that at?
That's a good question.
18.
18.
Yeah.
Okay,
Yeah,
perfect. And folks, this is an opportunity for you to see what a career is really like. This is a reason for you to take a ride with them, see what they do on a daily basis. And it's really, you don't get hands-on training like this, I would say, anywhere in the world, folks. And trust me, I've been a lot of places in this world, and ride-alongs usually consist of a bus with somebody telling you, okay, that's the van over there, and they're going into this place, and they're going to be doing this, and then they see them come out. You don't get to see it on this personal level, and we're talking about people who care about our community, people who are in it, who built it, who are there, and you're going to be the next generation, and we're asking you, imploring you to see about that. This is an opportunity for you to do that. And so with that being said, tell me, what is EMS Week? Remind me about that.
EMS Week. So like you mentioned, it's a worldwide week, It's just a celebration of EMS and persons who deliver the service that we do. Just a celebration of it. And what we also like to do during the celebration, during this week, it started the 21st, whether it's up until the 27th is EMS Week worldwide. Celebrating one another, so getting together. Lots of other places in the world. They do like huge conferences for EMS. So you're coming in, you're doing workshops, etc., furthering your skills, refreshing some stuff. For us here in Ireland, what we're going to be doing this week, not only celebrating, via luncheon coming up, but we will also be doing, delivering a little programs or presentations to the schools this week as well. We'll be going out into some schools. We'll be doing training as well. Tuesday was training day, and just really just celebration and furthering skills as we for EMS Week.
I think people got, and I'm not bringing up bad things because they seem to call you when things are at the worst. So we understand that, but there is a real sense of heroship to what you guys do. You guys as first responders, I think back to 9/11 and other, huge worldwide instances, and even with the global pandemic, you guys were working double and triple, and you guys put in a lot of effort because you were making our island safe, reaching out to people who really, I want to say the training level and the understanding became very evident because people didn't see you guys before. It was, as I said, drivers. Now they get to see, well, wow, this is the level that they do for our community, for our island. Tell me a little bit about that transition, with the pandemic moving in, coming out of it. I know we could be here for hours, but tell me a little bit about that.
Man, it's still kind of going on for us because now our shift has been, and because it was airborne, COVID being airborne, we're still very much masking up when we come onto scenes and dealing with persons. We're still keeping our taking our precautions and stuff like that, not just for ourselves but also for the public as well. We're still testing at the hospital, for example, weekly. So the shift, the changes are still kind of lingering for us. We're still keeping ourselves professional in that manner. And the major thing for us during, and Mr. Kendal, you can attest to this more so than me after I say this, but the major thing for us during was just how much we had to present for people in terms of care, like you said, the person's worst moments and stuff like that. So it was interesting to have to calm persons on another level because this is a global thing that was just rampant, right? Especially even here on island. So suiting up head to toe in all this PPE. We live in Cayman Islands, so it's hot.
It's very hot. PPE hot.
yeah, exactly. PPE goes hot. So, suiting up in us and being drenched in it and then going from call to call to call and then have to, in between patients, make sure our ambulance is ready again and clean to present to have another patient in. And then, of course, just dealing with the clinical aspects or presentations of any patient given. But yeah, the transition was hard, but we managed it. We got through and we did what we needed to do. We had at certain points we had to designate certain crew members to solely be on call for persons going through COVID and stuff like that. Yeah.
And to piggyback on that, the HSA was had all our PPEs. We were not short one day. They really looked out for the crew, and that what keep us safe.
Yeah.
And we as crew members of HSA/ambulance, we weren't in the peak of it. Thank God we didn't get really sick. We were really driving through it. Okay. Just after the tail end of it, then we start 1, 2, 3 start getting it, and but other than that, we did really good during that time.
Yeah.
Perfect. I know you guys, as we kind of get set to wrap up a little bit, speak to the future the reason I want people to hear is that your industry is a growing industry.
Yeah.
And people don't really see that. And I want our young people to know that there is more to healthcare than just doctors, nurses. There is viable careers outside the obvious, because you guys are part of a larger machine, and you guys are an intricate part of it. In fact, I say first responders because if a person can't walk or drive, they call you.
Yes.
On that note, we're going to take a quick break and come right back. You're listening to Healthcare Today with the HSA, and I'm your host, Chuck Taylor. Each and every Friday and Saturday, we get together and talk. Each and every Friday and Saturday, we get together and talk about all things related to your health right here on Healthcare Today with the HSA.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
HSA's cardiology clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.
Now back to Healthcare Today with HSA and our host, Chuck Taylor.
Thank you so much for tuning in to Healthcare Today with the HSA. I'm your host, Chuck Taylor. And as I said earlier, each and every Friday and Saturday at 1 p.m., we get together and talk about all things related to your health. And this week, we're talking about a very deserving group of people. Of course, these are our first responders right here in the Cayman Islands. Speaking of that, I know when we left right at the break, I asked a question about where do you see the industry going in how to get our young people involved in this industry. Can you just elaborate a little bit about that?
Yeah, like you mentioned, it's growing industry. It's very much needed and always will be around. And for future, speaking on the back to the training, because I'm part of the training team as well. Back to the training, again, we're just building and delivering more programs. Our aim is to deliver more programs, including helping to boost other branches within government or first responder branches like police and the Coast Guard and the regiment and stuff like that, delivering EMR programs, which is an emergency medical responder. That's the tip of the EMS system. The very bottom rung is an entry level, so you can get trained as an EMR. You don't have the same amount of skills as someone who is like myself, an EMT, but you have some basic knowledge of first aid and stuff, delivering stuff like that, and then you can move on from there. So the future does look bright because we have like this cohort, new cohort coming in. for us, we're furthering training, building more relationships with all these other branches and departments and stuff like that. Really just engaging, in growth. So, but Ms. Kendal, you can speak more on that too.
Yes, it's continuing every day. You can see it, especially, within our department, we're trying to keeping services going. We have to keep up our hours, for CPAM to register. We're just like anyone else. We got to keep up our hours. If we're not, we cannot practice. If we don't have our hours at the end of the year. So it's continuing education, and we have a good trainer within house that makes sure that delivers all those stuff there, that we have them CPR, ALS, all the stuff that we need to get registered with CPAM.
Okay, so we're as the Cayman Islands, we're globally registered as our units are globally recognized.
Yeah, so typically, for example, like the program we just delivered, so what'll happen is, we have persons come in and we just formed this relationship with an accredited body in the United States. They're accredited, and what they allowed for us to do was to run the program here on Island with the correct material. Like you mentioned, our trainer manager Donald Smith. He is a paramedic, a nurse. He's a trainer. He's properly built for this situation and this work that he does, and he delivers really well the program. So for us, we'll deliver a program, a course. Once students have passed the course, then getting accreditation from or passing what's called the National Registry of EMTs in the United States. That's the huge governing body that most of us will be attempt and fall under in the United States. And that, of course, comes with its, like you said, continuing educations, not just here in Cayman, but upkeep elsewhere. And then we have, and for us here on Island, just CPAM alone, like the continuing hours is very, very, very robust, and making sure that we have all we need to function appropriately.
Okay, excellent. So, I know we're going to get out of here, and I'll say this, and then I want you guys to respond. We are getting closer to hurricane season. Will you guys come back and talk to us about things that they should have in their homes to be prepared just in case, and just the idea of what to do in preparation from your standpoint about the season? Because a lot of times I don't get the professional view of somebody on Island like you guys, because you guys have a very intimate knowledge and years of experience. Because everybody, I'm running to get this, I'm getting this alcohol, and I'm rubbing out in the. What should I have just in case you guys are locked and can't get out? What should I have in case to get me to the point that I can wait for you guys to be there?
First of all, you should get, if you hear a hurricane threatening the Cayman Islands, make sure that if your medication, get to the pharmacy, get your medication, fill, get a little first aid kit, all those stuff, 5 days supply. Yeah. 5 days supply, have that on hand, and all the other stuff that come with a hurricane, your flashlight, your water, stuff like that to keep you hydrated. And please listen to the radio, keep intact. Do not come outside, because at that stage, after the winds hit a certain, miles an hour, I think it's 50 miles an hour, we're not allowed to come out for our safety.
That's what I wanted to put up, because folks, you have to remember the safety of these gentlemen and ladies are a requirement for us to be safe later. So we have to be able to weather out that storm until it's all safe and given, then you're able to come out on the road. Right. And that may be a day or two. It just depends on what has happened in the past and happening at that point in time that allows you guys the leeway to come out and say, okay, we're on call and things of that nature. So with that being said, gentlemen, thank you so much for stopping by. If they want to contact you, how can they reach out to the EMS?
Well, if they want to contact the EMS department, they can contact us through our manager, or the telephone number is, 949-8600, and ask to be transferred to the ambulance department or the HR department for right along as my co-worker just stated here. So, 949-8600. And once again, we encourage all our young Caymanians to come out and, get a career out of this.
Yeah. Excellent. Thank you so much, gentlemen.
Of course, thank you.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
HSA's cardiology clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.